Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Shiv Goel, internal medicine physician and functional medicine physician. Today's Kevin MD article is Agentic AI in Medicine, the danger of automating the doctor. Shiv, welcome back to the show.
Thank you for having me, Kevin, again.
All right. What's your latest article about?
So my article is about how the agentic AI which is coming soon, is going to shape and what we can do to create a right framework for things so that it's like can an AI scale the medicine? And this article actually started with a discomfort, which I couldn't ignore, that a lot of people were asking that, can AI replace you as a physician, or can AI scale the medicine? And I felt that was a wrong framing. The better question is whether we can protect the soul of medicine, human judgment, relationship, accountability, while rapidly developing autonomic system which is designed, who may never have sat with patients through fear, grief, uncertainty, and the end of life decisions. I use the ADVOCATE program as a catalyst in this article because it's a concrete example of the shift from AI that suggests to AI that can act in cardiovascular care, potentially on a fast authorization timeline.
So, for those who aren't familiar with AI agents, they're just autonomous software programs that use AI to perceive their environment, make decisions, and take action, sometimes even without human input. Today, and we're talking about in March, how are AI agents being used in healthcare?
Exactly. I think that traditionally clinical AI is often a decision support. They don't make a decision, they support it, such as it flags, predicts, or suggests something. But the agentic AI is goal directed. It can operate with a degree of autonomy, adopting over time and taking steps such as ordering, messaging, adjusting the medications, triage pathway. So the shift is happening from suggesting to doing. And that is why governance and override mechanism become non-negotiable.
In your article, you talk specifically about a government program, the ADVOCATE program. Again,
Yes.
for those who aren't familiar with that, what is it?
So the ADVOCATE program it is, as I just mentioned, that it's a shift from the AI. Instead of suggesting, it act as a physician, as a doctor, especially in the ADVOCATE program is mainly for the cardiovascular care. So it is not just for a fast authorization timeline, which was but also it is about how can AI gonna decide, what are the medications to orders, what are the diagnoses are. So instead of a physician, using it has to a physician would be busy instead of diagnosing, but justifying an AI.
Mm-hmm.
Like AI has already made the decision, and now it's a job of a physician to justify that diagnosis, that why this diagnosis it is. So I think it is this danger that we are actually shifting the AI from a non-human role to a human role. And I wish I had myself understood earlier that competence isn't just a pattern recognitions and guidelines. It is more like, as a human, it's more about the presence, listening, and a courage to slow down when something feels off. And I can give an example, such as a patient who comes to us and all the labs looks okay. And you ask the patient how they're feeling, and they say that I'm okay. But there's something which feels off, even if the matrix looks fine. And that is in that space, we as a physician decide to poke it further, to find out what exactly is going on, to find the root cause of the issue, where is it coming from. But an AI agent works on the input. What are the labs value look like? And this is what are the symptom a patient who is putting in over there. And a lot of time people are not very comfortable, putting their trust on a non-human AI, especially when it comes to very intimate things, their personal stories, or to things they don't feel comfortable. A lot of times they don't tell a physician also if the physician is not smart enough to understand their body language, how they are entering into a room and what their eyes are saying. It's a whole picture which we take into account. And I think the whole idea, the shift from a predictive model to a helper to a decision maker. And that's what the agentic AI is. They are the agent, they are the healthcare agents, healthcare physicians. I won't say the physicians, they don't go to school, but they are the main thing is the AI is here to help us. It is not here to replace us
We're both
because an AI can never replace a human.
we're both internal medicine physicians, and I think that we agree on the same thing, that doctors, we're just more than diagnosticians, right? And sometimes
Exactly.
it requires the relationship that we have with patients that helps them more than just simply spitting out a diagnosis, right? It's,
Exactly.
if AI replaces us in terms of just giving diagnosis, that's the same thing as calculators replacing mathematicians doing math, right? AI should
Exactly.
just be a tool,
Exactly.
right?
Then why do you people need to go to the school then? You have a calculator. A calculator will tell them. It's not just gonna make us more dumb, but it also gonna take away we like AI should help the healer. It's not here to replace the healer because it can never replace the healer. We are human. We are the one who created the AI.
Hmm.
So we take into consideration so many things, the unspoken data, the right layer of diagnosis, because diagnosis, like we have, like usually when I start seeing a patient, I keep my mind open. I don't jump on the things like, okay, these are the symptoms patient has put it in over there. And because a lot of times I know the diagnosis maybe before I even go and see the patient,
Hmm.
by looking at to their labs, looking at to their chart and everything. But many times that diagnosis is not really the right diagnosis at all. So many times patients go to the ER, and when I work in the hospitals and I go and see a patient, it's a completely different picture. So imagine the amount of autonomy which we are giving to an AI, which is actually replacing. And I'm not against AI at all. I am pro AI in a way that because AI is here, it helps me cutting so much of my work, such as as a script I use it. Sometimes I use it to to synthesize all the data together, so it can save me time. So I have more time for the patients to help them, to listen to them.
Yeah.
But if the AI can replace me completely, then and I have to justify AI, then I don't have to go to the medical school. I can have another AI open, and one can justify another AI, and anybody can become a doctor.
Yeah. Now, what if the AI makes a mistake? Who is liable in those
Exactly.
cases?
Exactly. And there at that time, the blame comes to the physicians when physicians has no role in designing that AI, because we over here is only justifying the AI. Okay, because the AI says this, it doesn't matter. I have to justify it because the hospital system or they have already established that
Hmm.
this is basically a diagnosis of the patient, and this is what it is. If the patient asks the questions why it is this diagnosis, or even if I feel like this is a wrong diagnosis, but I cannot put it because that AI who has been in the system already installed it. People they have already made the diagnosis. So I'm just there to give it a face, but I'm putting my whole life in danger because I know this is not a right diagnosis. So who is responsible for it at that time? The AI or the physician? And that's a very great question which you ask.
I love in your article, you wrote that the silence between words is almost as important as what is said. And sometimes an AI, as of today anyway, can't really replicate that.
It cannot, because it's all about creating that space between you and the patient or other person. It is the silence a lot of time which matters. A person who hold its breath before saying something, that tells you something is off. And even if their matrix looks fine, and that's when, as physicians, we try to ask more questions, give them that confidence that it is okay. It is okay to feel vulnerable. It is okay what you had gone through. You can trust us. But that an AI cannot do it. They do not have that emotional part to it. They don't understand what it means to hold the space, what it means to give the time for the story to unfold itself.
Now, eventually, all of this can be programmed into an AI, but still, the question we need to ask patients is that good enough for patients, right? Like, how is that different from these people that you hear having personal relationships with ChatGPT, right? Even though ChatGPT is a wonderful conversationalist, but they're having essentially a relationship with a machine. And that's a question that we need to ask patients. Are they going to be comfortable no matter how polished an AI is and all the things that we're talking about eventually can be programmed into AI, but at the end, do they want that relationship with a machine or a human?
That's a very, I think, a good question because we have already seen this happening. And I feel like somewhere we all have already started to have some kind of a relationship with AI, whether we are using it as a scribe, as a mentor, people are using us to confirm something like we used to ask our colleagues about something or our friends about if we have a problem. Now we ask AI if we want to write. So we are already having some kind of relationship with the AI, even though we don't name it. And the real problem is, I feel that it is not that we can't have a relationship with the AI, but it is that are we really having a right relationship or do we have any responsibility? As if I feel like the AI is exposing what was already broken in the system to begin with.
Hmm.
Such as, there was this news I was reading about a teenager who committed suicide with the help of an AI because he was in love with the AI. And everybody, been blaming the AI for that. But I feel that it just exposed what was already broken. Where are the parents? Where are their friends? Where are that social structures which keep the people so lonely and alone that they can't even share their issues, their problem with them, and they have to take in help of an artificial intelligence with whom they feel comfortable at 3 a.m. And this is, I think, a very important take-home message is that, which I feel that AI should serve the healer and
Mhm.
not replace the healer. And when it comes to relationships, I think as humans, we should be paying more attention to what is happening around us, in my own family and in my neighbor. Even if we start from small responsibilities, I think we can still prevent something which is not yet came, and we don't know what are the consequences of that would be.
In your article, you talk about the path forward with AI being human first. So, what would that mean?
That means that me as a human, we have feelings, we understand so many different languages,
Mhm.
such as your body language, your the pose, your eyes, your and a lot of those things. And I know you mentioned that AI can be trained. I don't think an AI can be really trained in picking up all those clues because there's another thing there. I can pretend that to be a at certain ways to just get my pain medications, and I know that AI, even the patients sometimes fool us, so I don't think AI can actually or should replace.
Mhm.
Otherwise, what would happen? Then we don't need the physicians.
Mhm.
Just have an AI agents everywhere. All the medical schools, they just close down. We can just work because whose license is this? So they can give a license also to the AI. Why to use my license on that? I can be just like as a as nurses or nurse practitioners, they work under a physician license. We can work under an AI license. And that's where I think this is going if we do not do anything. Because if the technological companies who are creating those AI agents, and for whatever financial or non-financial reasons, do I have any say in that what is coming? Or it is just has already decided and I will have to just follow what is coming.
We're talking to Shiv Goel, internal medicine physician. Today's Kevin MD article is Agentic AI in Medicine, the Danger of Automating the Doctor. Shiv, as always, will end with take-home messages they want to leave with the Kevin MD audience.
Yes, I would say it again that AI should serve a healer instead of replacing the healer. And high-risk clinical AI must remain clinician supervised and clinician overridable. If we automate the doctor instead of automating the bureaucracy, we may gain speed and lose the very thing that makes medicine healing, relationship, judgment, and accountable human presence.
Shiv, again, thank you so much for your insight. Thanks again for coming back on the show.
Thank you for having me, Kevin, again. Have a good day.